Hello, and welcome to everyone joining us today, either through Zoom webinar or the live cast on YouTube. My name is Lucy Fromowitz. I'm the Vice Provost here at York University, and I have the pleasure of moderating today's session that brings York University and the Toronto Public Health COVID-19 Outreach Group together. I'd like to start with a land acknowledgement. And I appreciate that we are not all in the same space. So please take the responsibility to undertake your own land acknowledgement. It is part of the reconciliation that acknowledges our Indigenous peoples as they have taken care of these lands for 15,000 years. As this event is virtual and we are not gathered in the same space, I recognize that this land acknowledgement might not be the territory that you are on. We ask in this case that you take the responsibility to acknowledge your area. As a member of the York University community, I recognize that many Indigenous nations have long-standing relationships with the territories upon which York University campuses are located that precede the establishment of York University. We begin today by acknowledging that we walk upon the traditional territories of Indigenous peoples, and we recognize their history, spirituality, culture, and stewardship of the land. We are grateful to all Indigenous groups for their commitment to protect the land and its resources, and we are committed to reconciliation, partnership, and enhanced understanding. I would like to officially welcome and introduce you to our Toronto Public Health Rapid Response team, today represented by Andrea De Silva, who is leading the presentation today. Before I turn things over to our special guests, I'd like to remind you about the agenda. The session in total will take about 90 minutes and is being recorded. It's available for viewing at a later time using the Vice Provost student website. The information that is presented in this recording is accurate as of the day of the presentation and may change rapidly depending on the course of the pandemic. This recording will be available for 7 days after this presentation date and will then be removed to deter the dissemination of any out-of-date information. Please always check the City of Toronto's COVID-19 website for the most up-to-date and accurate information by visiting toronto.ca/COVID-19. In the first part of today's session, you will hear from our Rapid Response Team representative, Andrea, who will deliver a presentation covering such topics as COVID-19, how it spreads, symptoms, and the most up-to-date information. She'll cover topics like how to reduce the virus spread and how to stay safe, choosing and wearing masks and face covering safely, making the right decisions about going out, social stigma and discriminatory behaviors, COVID-19 testing information, self-isolation, finding the right support, whether it's government, health agencies, mental health, or community services, and available resources from trusted sources of information. Following the presentation, we will be answering questions. Many of you have pre-submitted questions, and thank you so much for doing that. Time permitting, if there are questions from those of you who are watching this, we would also like to take those questions. If there are more questions than we have time to answer, we will get back to you through email. A few technical things. If you prefer to listen to this session en français, please click the Zoom link that was provided, and you'll see the icon in Zoom on the bottom right menu that allows you to change the language to French. You do not have this option if you're on YouTube. You can also locate the chat function, but only on Zoom, in the bottom menu bar. There will be live captions available, as well as ASL interpreters joining us today. And I'm grateful to all the ASL interpreters. With that, I'd like to turn it over to our Toronto Public Health representative, Andrea, to lead the next part of the session. Welcome, Andrea De Silva.
Hello, everybody, and thank you very much, Lucy, for the wonderful comprehensive introduction. As Lucy mentioned, my name is Andrea De Silva, and I am from the Rapid Response COVID-19 Outreach Team. And I will be providing you with the most accurate information based on the research of Toronto Public Health that I have. So let me start the slide for you. Most importantly, I would like to thank you for all those who can be here during this very stressful and probably quite time constraining times for you. I have a university student with me at home myself, and so I know how difficult it is to find the time. So thank you for those who can make it. I really appreciate it. Also, the information is changing constantly, as is all the situation around the COVID is evolving. So some of the slides have been actually added today. So please bear with me and thank you. So a lot of the information also you may know, but I'll just do a quick review with you. Coronaviruses are the large viruses, are a large family of viruses, and the human coronavirus is a common and led to mild illnesses. And what we know about it, about the COVID-19, is that it is a new strain that was discovered in 2019. So how does COVID spread? Which I'm sure most of you may know already, or for sure know. It is mainly, so COVID-19 is a respiratory infection, and it is a virus that
Hey,
spreads.
Andrea.
Yeah.
I'm so sorry to interrupt you, but your screen sharing just isn't turned on. Could you try it again?
Oh, I'm so sorry.
It's okay.
Here we go.
Sorry to interrupt you. Perfect. That worked this time.
I'll skip to what I have said. Apologies again. So how does COVID-19 spread? COVID-19 is a respiratory infection, and it is a virus that spreads through droplets that come out of your mouth and nose when you breathe, talk, cough, and sneeze. The droplets can travel 2 meters, and that's why we can say that COVID spreads through close contact with someone who has the virus. And they can also, these droplets can also spread from, for example, if you just, talking, singing, or even laughing and shouting, and depending on your surrounding, the weather and whatnot, they can spread even beyond 2 meters, in fact. COVID can also land on a surface, and some surfaces, it can survive up to 72 hours. And it can spread if you touch the surface and then touch your mouth, nose, or eyes. However, it is not easy to be spread this way. At this time, there are no reported cases of COVID being spread through food. I know that was that may be one of the questions that I get a lot. So the period people are most contagious is when they are sick and 48 hours before they have symptoms. Some people may fear that, and perhaps maybe you guys who are at the inner residences may fear that it spreads through ventilation system in the buildings. However, there is no evidence to support that neither. So COVID-19 symptoms. When we all started, it just was what we heard was maybe just a fever and cough. And as we knew more about COVID, we understand that there is many ways that it spreads, such as difficulty of breathing, sore throat, many symptoms that we may have, such as difficulty of breathing, sore throat, runny nose, loss of taste or smell, not feeling well. Some people may feel just tired or have sore muscles, and vomiting or nausea could be one of the symptoms. Mind you, there is many times that people don't have any symptoms at all, or they have very severe symptoms. And symptoms can take up to 14 days after exposure to COVID-19 to appear. So contact your doctor if any of these symptoms are or become severe. If some of you may have a little brother or sisters, so this is just for a slide about children. Children usually have mild symptoms, which are typically fever, cough, sore throat, feeling unwell. And it is very rare, but some may get an inflammatory conditions, and you would notice because the fever would be lasting longer, they would have tummy ache, diarrhea, vomiting, some may be pink eyes or rash. And the same way, if these symptoms would get worse, then you would just contact your provider, healthcare provider. So who are the people at most risks for serious illness? So we hear this all in media and read about it. It is the older adults, 60 plus, and it's also a people with weaker immune system, and people that, for example, going through a treatment such as cancer, so their immune system is compromised. Any autoimmune disorders or which are lupus, rheumatoid or arthritis, or people with other chronic diseases or conditions such as asthma, heart diseases, or diabetes. And it is advised, especially for this age group, to call 911 if someone is having difficulty breathing or experiencing severe symptoms. What would you do to reduce virus spread? So this is a very important slide. And I guess it's never enough of a reminder. Wash your hands. You want to make sure that you're washing your hand often, following the proper hand washing routine, and especially avoid touching your face with unwashed hands. So some people may have habits, biting nails, whatnot. You see children having that, so it's quite difficult. You're not always remembering to do that, right? So remember to wash your hands to avoid touching your face so much with unwashed hands. If you can't wash your hands, use alcohol-based 70 to 90% hand sanitizer. It is recommended not to buy sanitizers. They may not be as effective in a dollar store, so probably you better off going with Shoppers Drug Mart or Walmart type of 70 to 90% alcohol hand-based sanitizers. And you maintain a 6 feet or physical distance from others. You wear a mask or face covering when in close contact with others, especially when indoors. And cover your mouth and sneeze with your elbow or tissue, and throw the tissue and wash your hands right away. And clean and disinfect frequently touched surfaces. Hopefully my interpreters are keeping up. I may be speaking too fast. So that's for ways to reduce the spread. So why do we wear masks? So masks and face covering. When mask protects me, you protect me, and I protect you. That's how it works. So it's just showing you when nobody's wearing a mask, then it's easy for the droplets to travel, and you can easily inhale the droplets. If only one person's wearing the mask, then it better be the one that is infected, but we don't know. So for that reason, it's really the best and best way for everyone to wear a mask. So I protect you and you protect me. And the highest risk for infection is with prolonged close contact. So the longer you are in a close distance, which is 2 meters or less with a person that is infected, the most likely or more likely you are to get the infection. And people may unknowingly pass the infection to the others because they do not have symptoms. They're asymptomatic, like we mentioned previously, and they have not yet developed the symptoms, or they have not yet developed the symptoms. So they may be pre-symptomatic. So the mask bylaw states that mask is mandatory in indoor public spaces and in enclosed common areas, in apartment buildings and condominiums. Every building, however, and a business may have their own mask policy, and so you may need to follow their policy. There are some exemptions for masks, not wearing a mask, and it is for people that have a medical reason. They don't need to disclose or provide any proof of their medical reason. Unfortunately, if this is a scenario where there may be a store you're going into and they have their own policy and they absolutely don't allow people without a mask, then you may have to choose another store to buy the necessities that you needed to buy for yourself. And so the proof is not necessary, or we don't need to provide proof. And also children under 2 are exempted from wearing a mask, I guess, because it would be quite difficult for 2-year-old to, keep something like that on or to understand. So there is often questions about what mask is a good mask or what type of mask to choose. So as you see on this slide, you should not reuse your mask the next day or at any point when you take it off. That's very important to know. Cloth masks are a good option because you can make them at home and you can wash them. It is good if the mask has 2 layers. So the more layers, the better. And it's made out of cotton or linen. because it's easily to breathe, and it's those materials, those natural materials are do not provide any allergies. Some may have a skin rash or different allergies, reactions to the materials. So cotton and linen would be a good choice for you. Don't share your mask with others, of course, unless it has been washed first and that person doesn't have a mask and you need to offer it. And wash your mask in hot water and detergent before you use it again. It is okay to be washing your mask with your other clothes. Just make sure preferably it is a hot water, and when you're drying it, that it's on a high heat to dry. So wearing a mask safely. How do we wear a mask? Before putting the mask on, always wash your hands and secure hair away from your face. Because if you get a couple of pieces of hair stuck in the mask and then you need to readjust it, that's when we were talking about touching your face. Touching the mask is the same way. Then you would have to probably switch your mask, because unless you just washed your hands. Place mask snugly over your mouth and nose. Make sure there are no gaps. Avoid touching your face and mask while using it. Do not leave the mask on your neck or forehead or hanging from your ears. We see that a lot. The mask is there to be covering you and protecting you. So if you are wearing mask, you wear it properly. Change your mask as soon as it gets damp or soiled, because when the mask is damp, it is not properly filtered. Remove the mask without touching the outside of the mask and laundry it before wearing again. Then wash your hands and clean surface that the dirty mask touched. Most preferably, you would store your mask somewhere in a dry place. If you need to have a extra mask bringing with you, because during a day, once the mask gets moist, it's no longer effective. So maybe have it in a rather than a plastic bag where it could get moist, you should take a either envelope or maybe a paper bag would be a good option. So the masks that are recommended and that offer the best protection. So you see on the first picture here, it's the mask that covers your nose, mouth and chin without no gapping. As we were saying, it should be a mask that has 2 layers of fabric like cotton or linen. For more layers, the more you prevent the droplets from spreading. And the good mask, the best mask is the one that fits you the best. The face shield is not an alternative to a mask, as it is not known if face shield protects others from the spray or respiratory particles. Then there is a mask with exhalation valve. These are also not recommended. They may filter dust particles in the air as the person inhales, but they may not filter the virus particles of respiratory droplets. This means droplets from person can be spread in a room, reducing the benefit of the mask. And then some may have seen people wearing the clear plastic masks. These ones also that they have gaps and which allow for the germs to spread and cannot be cleaned and disinfected before the uses or between the uses. So that one is not recommended neither. So your best option is your cloth mask that is covering your mouth, chin, and nose without gapping. So mask do's and don'ts. I may have mentioned these as we go already, but there it says, do keep the mask in a clean labeled bag. You need to wash your hands between putting it off and when you put it on and take it off. It needs to be covering mouth, nose, and chin. It has to fit snugly with no gapping, and it has to feel comfortable. And change your mask when it's wet or dirty. So that, and during a summer, probably that was more of an issue of the mask getting wet. Now coming into the winter months, that may be a bit better. Put used mask in a bag labeled, well, bag labeled dirty. This is mainly, if you, this is for those who just need this type of labeling or just for you not to forget. But of course, like I said, you can just keep your mask in an envelope, or dirty mask is okay in a plastic bag, or immediately, if it's a mask that you buy that is for one use, just dispose it in a garbage immediately and launder it before wearing it again. And there is some don'ts. Don't put mask on children under 2. Don't wear mask that is too loose. Don't touch your mask and face. Don't keep a wet or dirty mask on. Don't leave it hanging. Don't put it under your nose and chin. Don't share your mask with others. And don't forget to also keep 6 feet from others. So some of you may know about the COVID Alert app, or hopefully most of you being the students of university. So that is an option. And you can download the app. If notified, you will know once you have the app. If notified, you will know to self-isolate and get tested. That's one reason to get it. If it does not collect or share your personal information, it will work even better the more people download it. So the more people, the better. And it is an added layer of protection to slow the spread. So you may remember we used to talk about social bubbles and how many people can stay in one bubble. But now social bubbles are no longer recommended. You can have close contact with people in your household. However, you have to maintain 2 meters of physical distance with everyone else. And when physical distancing is not possible, that is when you really have to make sure to wear your mask. And nowadays we are all advised to, think carefully, make decisions about going out. Just think about it, just to just to protect yourself as much as you can and not expose yourself to potential infection. So think about, is it important? Is there somewhere I need to go, or something, somewhere I want to go, right? So if you don't necessarily need to go there, then maybe it's best not to and stay home. Can it wait? Is there a low contact way to do it? Am I going to be in a group that I know is too big to be safe? Can I limit contact with people I don't live with? And will vulnerable people be there and I can take step to protect them? Right? So even if it's not for yourself and you're making the decision to go out, you, like we said, some people, especially for youth maybe and young adults, they may some not even have a symptoms. So make a wise decision to go out, because you could be asymptomatic going out and passing elderly, and you happen to cough or whatnot, and they are the vulnerable group. So look out for others as well. So probably many of you guys, you know, going to the university, maybe needing to use public transit. So just some few tips on when you are using the public transit. Avoid traveling during peak hours if possible. Of course, again, keep your distance from others if possible. Wear mask and face covering, and throw it in a garbage when you're done. Wash and sanitize your hands often as you can. Maybe right after, if you have to switch between subways, you know, you can sanitize in between. That would be that is another, you know, helpful way to keep protected. And do not use transit if you are sick, of course, and if you're self-isolating. And be more cautious, you know, when you try to just practice your cautiousness. Okay, here I am, I'm going into the subway. Let me try to think of, you know, be mindful of not touching my face, eyes, nose, especially when I'm exposed and when I'm in a subway and there is a possibility of touching things that may have surfaces that may have virus laying on them. This is for faith-based services. For those who practice faith and you know, visit various you know, church or mosque, make sure that you keep social distancing as well. Bring your own material and your own prayer book or rug. Do not sing. As we were saying, that it's not only by coughing, sneezing, but it's also the germs can spread by singing. Keep your children with you. If you're going as a family, do not gather in groups. And rituals like communion are not recommended. So for schools, especially for the elementary and high schools, we have public health nurses assigned for each individual schools. This is just a slide for you understanding a bit with the back to school, mainly for those grades junior kindergarten, senior kindergarten to grade 12. They go through daily screening for COVID symptoms. Their mask required is for grade 4 to 12. And probably the same as for you, students stay in cohorts while they're in school. And there's the requirement of physical distancing, hand washing, and enhanced cleaning. So these are the same prevention tips we have been discussing, you know, for anyone. They are helpful for all of you going to schools. And this also goes for staff and students. They are the ones that are screening every day as well. And hand sanitizers will be available. It should be available at schools if you need them to do enhanced cleaning. So this is a slide for parents, for those who have probably younger children. If someone at school is tested positive, then parents will be notified, but the person identity will be not shared. Not all students are at risk if it is a positive case at school, and that goes for you as well. So if you guys have a positive case at school, not everybody is at risk. Public health will follow up with those close contacts, likely included in a class cohort. So they will determine and assess, and based on the information given, they will find out who the close contact was, and they will then be contacting those close contacts. Close contacts will need to self-isolate for 14 days and be monitor themselves for symptoms and get tested. And other people at school will be monitored for symptoms, but they don't have to self-isolate. And public health will continue to monitor and notify parents, staff, or other students in your case if there is a risk, if staff of risk as needed. So for example, if you have if you guys may have some kind of a gathering or so happen to go to a party, then what would be happening, everybody there would be determination of who was a close contact, and those close contacts would be contacted then. So Halloween is coming. I don't know how much for you that what does that celebration necessarily mean for the university students, but for Toronto, it is not recommended at this point to go out and trick or treat. So there is other ways, maybe for your siblings, that you can encourage them to celebrate Halloween, and for yourself too. So avoid gatherings with people you don't live with. And, there is on this slide, you can see a different type of things you may do as an alternative. You can do celebrations virtually. Maybe you guys want to watch a scary movie on Halloween. You can still dress up with those who live in your household. And so that's what you can do for Halloween, unfortunately, this year. So who should get tested? There is no cost, even for people without health insurance, OHIP, including visitors and people without status. So some people with no status, they may have not known that and may be reluctant to test, but there is no cost, and everybody will be the way you get your results, you could find them on a website if you have given your health card. And if you haven't, then the person that have tested you, you may give them your contact directly, and they would be calling you if you test positive. You should get tested if you have COVID-19 symptoms. If you don't have symptoms, but have had a close contact with someone who has COVID, that is another reason to get tested. Or if you have been exposed to a confirmed case of COVID in this case. If you ask by public health to get tested, If your healthcare provider requests you to get tested for a medical procedure, or if you're going to visit someone in a long-term care home, that would be another reason for getting tested. You are eligible for testing as part of a targeted testing initiative directed by the Ministry of Health, Ministry of Long-Term Care, or other ministries. Some maybe, I don't know how many of you have had the test already done, but there's been questions whether it hurts, how does it feel? So it has been compared. I myself haven't had that opportunity yet, but it has been compared to feeling like when you jump into the pool and water goes in your nose. So it is not painful, but it is surely quite uncomfortable. There has been, some research is done and trying to do the test another way, but it is not yet been approved by public health. So unfortunately, we have to go through this uncomfortable testing for now. The benefits are obviously a peace of mind. It helps you protect your family and caseworkers and friends and your teammates and your schoolmates. And it helps to slow down the community spread. So if you are looking for COVID-19 testing locations, you can just simply Google COVID-19 testing locations on Toronto Public Health website. And like I mentioned, you can check your results online. It is very quick. You just Google check results and it is on your right corner. There will be a link. You just input your health card, and you will prompt you and you will see what to do and you will see your results. And the other way is to calling your TPH, calling Toronto Public Health. So what happens once you get tested? So if you test positive, Toronto Public Health will get in touch with you and will talk about you. They will talk you through every step that you have to do. They will also inform you. Ask and investigate who has been a close contact. And if there have been such a contacts, they will need to isolate, self-monitor, and consider get tested as well. Of course, we do not share identity and personal information with your close contact. And by law, your information is confidential. So following all instructions given to you after the test, you may be told to self-isolate. If so, follow all the instructions provided. And the test may take 1 or more days to return. Actually, now with the increase in the negative cases, in the positive cases, there has been also backlog, so it may take up to 4 days. And visit the COVID-19 ontario.ca to check your lab results. We already mentioned that. The hospital or lab associated with the assessment center may also give you the access to an online chart to get your results. Toronto residents who have issues accessing results, they may contact the Toronto Public Health. And if test is negative, you will not be contacted by public health and you can return to work activities 24 hours after, or to your school in this case, 24 hours after symptoms go away, as long as you are not self-isolating for other reasons and you do not have any other new symptoms. So if there is also time where you may test negative and still have the virus if you were tested too early or have almost recovered. So it is important to always continue to monitor yourself for symptoms. So these would be, again, the reasons to isolate from others. If you have COVID-19, if you have the symptoms, or if you've been with close contact with someone that has symptoms, or if you have returned from anywhere outside Canada within the past 14 days. How do you do that? How do you self-isolate? So safe isolating, meaning you need to stay home, even if your symptoms are mild. So don't go to work sick. Don't have visitors in your home. So that's very important. There is no one visiting. Limit contact within household with household members. So even if you're at home, you want to protect others at home before you know your results, or if you do. And if there is opportunity and you have, bigger place where you're staying, then you can stay in a one room. And whenever you do need to go and, for example, go to bathroom, make sure to always sanitize everything, wash your hands to protect others. Don't share household items like hand towel, dishes, or cups. It would be good to keep windows open for good airflow. And just basically always keep in mind that the droplets spread 2 meters away. So even it's advisable that you may wear a mask in the household when you're isolating, that everybody's wearing a mask, and keep that distance in mind. And okay, if you need supports, there is plenty of supports. Any question that you have and that may not be answered today, or whatever question you have, you can call 211. You can also text, send an SMS. There is a number below. If you guys want to take a screenshot, this is a good resource. They are open 7 a.m. to 9 p.m. There is also a live chat. So 211ontario.ca chat. Many of you may prefer that. That one is also open 7 a.m. to 9 p.m. Or you can use an email. But the actual line itself, if you call, is open 24 hours, 7 days a week. And you may even get interpretation. If you don't speak English, you can request specific language and they may tell you when that person would be available. There is 150 languages available, and it is all confidential information and free information. So it is very important, to make sure to take care of yourselves and your mental health, because these are very stressful times for everyone. On top of many of you, you're going through new ways of learning. Everybody, for those who are in the first year, like my son, they were probably excited to meet new students, and really looking forward to that first year. And unfortunately, it's all very new to all of us. And so it can come with a lot of stress, not really having the opportunity to socialize the way we would like. And so try to just make the best out of it, stay connected virtually. You can talk to your neighbor or check in on your neighbor virtually, or have a video conference or chat. I see my son having a listening on a lecture, and he's telling me that there is 400 students, but when I look at his screen, all I see is the professor. So maybe making yourself available on a screen, at least there would be some type of a connection, to be able to see who actually is, since you can't go in a person, but you can at least see who is your teammate. So maybe try that sometimes. Be active. um, you're studying a lot, you're going through midterms, make sure to take a break. So if you can, and keep your brain going, keep your brain giving it oxygen before that test. Go and, take a walk or have a quick bike ride, and make sure to eat well. Some of you, especially in, now studying, you forget you're into, trying to focus, finish your assignments and forget to eat. But that regular, good healthy eating enough, and especially sleeping enough. Just thinking of my son again. There is a period of time where the sleep is the best, which is just before 12 o'clock. So don't go and sleep at 4 a.m. and sleep on. Your best sleep is always just before midnight. Try to get those 8 hours of sleep if possible. That is crucial. Take time to engage virtually or by phone with your family. So we were talking about neighbor, and but also, of course, your family and the loved ones. Learn something new, take a new hobby, or I don't know if this is for you, another online course. Gosh, maybe not for you. um, Help someone else doing something good. It is really surprising how doing good things can really, and just someone saying thank you to you, how good it feels, and it just makes you feel warm, and it creates that positive feeling for you. So do something for you, good for others, to make yourself feel good and others in these stressful times. Reach out for help and talk to someone you can trust if you think the stress is too much for you. There is ton of professional help, so please make sure to do that. And again, call 211 to get connected. We have a great, or they have a great mental health services. This is my new slide. Sexual health. So some of you may be dating. Just, quick reminder that you are your safest partner. So when there is, any connection between you, kissing or whatnot, that will be, you will be more prone to the risk of having being more vulnerable to COVID-19. So especially if you're feeling that you are not well, but you're excited to see your partner and whatnot, but make sure to keep that in mind. Not only to have sex or whatnot with consenting partners, but make sure that if you are feeling unwell, that you let your partner know, hey, today it's not a good time. We see each other. I'm starting to feel off. Let's wait till my symptoms go away, right? Or you can always consider virtual chat rooms and go meeting people that way. So there's a lot of scams. You guys, your generation, I'm sure you are very familiar with these and aware. And the trusted sources of information. Right now, if you need to find an information, you would be surprised. There is ton of information on Toronto Public Health, pretty much anything you need to know. Ontario Health or any Government of Canada sites would be trusted source of information, and of course, your healthcare provider. You can also call Telehealth Ontario. And I think 4:59. So we will be going to, I think I'll be passing it on to Lucy before we do the questions.
Terrific, thank you. Andrea, that was terrific. I really appreciate it. And while you were doing your presentation, I had an opportunity to look through many of the questions submitted, and I do want to share that you have addressed many of them. In some cases, I may repeat the question because the answers are important and worth repeating. I remind everyone that for those of you who are on Zoom, there's a chat function. It's available for questions that you may have now as a result of the presentation. And you may also have an opportunity to take some questions live if people would like that. So with that, I'm going to start with the first question. And the question is really directed more to the university. A student asked, what happens if students in one of the residences on campus has COVID, or several students? Will they be contact traced and other members of the building or area informed? And will they be staying in their rooms? And will York provide accommodation? So first of all, yes. As soon as a student doesn't feel well, who lives in our residences, we stay in close contact and ask you to be in touch with your RLC or your DON, someone who is in residence. And in a few moments, I'll also speak about the form that you can submit every single day. York has set aside significant numbers of rooms so that if any of our students in residence become ill, we will help them self-isolate in one of those rooms. The rooms are self-contained. We will also ensure that food is delivered every day, 3 times a day, to any individual self-isolating, take care of linens, things of that nature, and we will touch base with every student who's self-isolating once and often twice a day to check in both on how you're feeling as well as your mental health in case there's someone that you want to talk about. If you need to be transported to get testing, or if you're not feeling well and you need to go to a doctor or the hospital, we will also support you in that way. So the short answer is, yes, we have made lots of accommodations and taken all the precautions to ensure that we can support you in the event you're not ill. In the event, I'm sorry, that you are ill. It always starts with you. And we ask you to contact your DON or residence life coordinator as soon as you're not feeling well. You don't have to think about, is this COVID or is this the flu? We'll support you and help you move into self-isolation right at the first signs. Andrea, I'm going to direct the next question to you. And this was an interesting question that I also am curious about. When I go grocery shopping and bring my groceries home, should I sanitize them before I put them away?
Thank you, Lucy. So, just with regards to the actual food, at this time, there is no reported cases of COVID-19 that were being spread through food. So that is somewhat good, I guess, good to know information. And as always, it is important to follow food safety practices to help prevent foodborne illnesses. But while it is possible to contract the virus from contaminated surfaces, the majority of transmission is from respiratory droplets through the direct contact with people. So the best practice, basically, if you know what it means is that if you're getting a food from let's say if you're Ubering your food or getting it delivered from somewhere, the bigger worries here would be the person that is giving you the food, right? So that's why we often make a note that we want to leave the food by the door, which would be preferred. The food itself and the packaging, um, once again, there are surfaces that may keep that the virus sits on for up to 72 hours or perhaps even more. Um, often the cardboard surface is maybe one of them. So that's why the best way, you just unpackage your food, place it on your plate and whatnot, and throw everything away. And then to be safe, you disinfectate the table it was on, wash your hands. Always wash your hands before you eat your food. And that's the best advice for that I have for you.
Thank you for that. The next question is, if I was in class with a COVID-19 positive student, but we maintained physical distance and we always wore a mask, do I need to be concerned?
So if there is a COVID-19 positive case in your class or in your cohort, you will be contacted by Toronto Public Health nurse, and they will conduct assessment. For example, whether you are, so they will find out, now the important fact is whether you are high or low risk. And based on that, they will provide you with instructions based on the received information. They will provide you with instructions. So if you maintain physical distancing, you always wear mask. Do you need to be concerned? You never know, right? So it is a difficult thing to say. No one can say whether you could be touching something that was infected at that very moment, and that could have been the reason, right? Not necessarily the person that was the positive case. But in any case, you would be contacted if you are considered high risk. You will be contacted and you will be given the exact instructions you need to know.
Thank you. Now, this follows your answer. And the question submitted was, I heard that Toronto Public Health has stopped contact tracing. Is that true?
So as part of our the usual course of outbreak management, with the increasing numbers of positive and high-risk cases, Toronto Public Health needed to or is making a strategic shifts to prioritize cases and contact management with focus on the high-risk scenarios. And so low risks now, it is the responsibility of the person that tested positive to let their people that they may be thinking they potentially have been in a contact with in some way. So it's up to them now to inform them, because there is quite a, there is the numbers are increasing, and we have to prioritize things. And at this point, there is no capacity to be contacting everybody.
Thank you, Andrea. And I will also add to members of our York community, Once you inform us, we too will be in touch with you, and we will ask where on the campus you may have interacted, what times, who you might have interacted with, and we will work with Toronto Public Health also to alert individuals who might need to self-isolate or might need to go for testing. The next question is directed again to the university, and that is, why do I need to complete the daily screening forms if I live on campus? We recently introduced mandatory daily screening forms, and this is to ensure that we are able to support you at the earliest possible time to prevent an outbreak, risk of transmission, and overall health and safety. We ask that you fill that out every morning, and we work alongside public health. Members from our York apartments, which are very different than our undergraduate residences, aren't in what's called congregate housing. However, we ask that you too submit that form, again, because our interest is to support you. As soon as a student informs us whether they're living in the apartments or in any of our residences, as soon as you inform us of any symptoms, tick off on that list, we will be in touch with you, and we will find out how we might support you, any assistance you might need, and whether it's best for you to move into a self-isolation unit. We have been asked also in the screening how we store that information. The information is stored with extremely limited access, and it's access to those people who are going to contact you to see how we can help. And that's when we're going to be asking you who you've been in touch with, whether you need transportation to be tested, whether it's best to move you into a self-isolation unit, and to flag any of the services which you might need. We will not be tracking submission for enforcement, so there are no penalties if you choose not to submit the forms. We, however, ask to keep our entire community healthy and safe, that you do submit those forms every day. And I'll thank you in advance for doing that. Andrea, the next question.
If I can add to that, and we've been talking about when and how people are contacted, students are contacted, and in the initial question by the graduate student, they were asking what happens if there is an outbreak in the resident campus. So what some may not understand how the outbreak works. Outbreak is not it is not an outbreak until 2 or more laboratory confirmed COVID-19 cases in students, staff, or essential visitors in school settings within 14 days, where there is at least one of these cases that have reasonably acquired their infection in school setting. So it could have been either on a transportation going to school or before or on school premises. And once it is considered an outbreak, then I think you may have mentioned that word. It is then, Lucy, the congregate team that will be taking over with working directly with the Toronto Public Health nurses. And, each case is individual, and there is a lot of things that, are taken in consideration when they thinking whether they will close down the particular floor, whether they will be asking for a particular cohort to isolate. Some of them, there may be various schools and there may be different outcomes. So not necessarily that when there is an outbreak, which is the two which has to have the two epidemiological links, doesn't mean that that school is or that floor is going to be isolating. It's different for every case.
Thank you, Andrea. Maria has submitted a question, and she asks, how does the COVID-19 app work? What if I just pass someone in the street and I get an alert?
Thank you for the great question, because you guys are all about apps and electronics. And so it's wonderful, and it's very helpful if this app is downloaded. So the app is easy to use and safe, but you have to have a current mobile phone with a data plan, which probably most of you have. It is also in English and French only. It does not track, collect, or share personal health information, your identity, or your location. So the app uses secure Bluetooth technology, which allows phones with the COVID Alert app to exchange random codes when they are within 2 meters of each other for at least 15 minutes. So this will happen when they are within 2 meters of each other for at least 15 minutes. If an app user tests positive for COVID-19, they can then anonymously alert other app users who were in close contact with them during past 2 weeks. This will not include sharing any personal information or identity or the time and place of exposure. And the app has been reviewed by federal and Ontario privacy commissioners, and it does not work on some older operating system, but it is still very useful as one of the many ways we are attempting to stop the spread of the virus.
Thank you. Andrea, you touched on this during your presentation, but I will ask anyway. One of the questions is my mask, my face covering, still effective if it becomes moist or wet?
So, like I mentioned, because I was thinking this may be asked, basically, if the moist will impact, then it will decrease the effectiveness of the mask. It's difficult to explain all the logistics. It's something about, the different, and it also depends on what fabric it is with and how the threads are put together on a fabric, whether the particles can pass through or not. But all you need to know is that if the mask is moist, meaning, if even if it's possibly rained on it, right? It's not necessarily that you may be sweating or you may be coughing, breathing, and that will cause the moist. It could be also the rain. So always keep in mind that it would be good to have a second mask, available for this type of incident if it gets wet. And if it does, store it somewhere in a safe place and wash it. And we were talking about it, wash it right away and before you use it.
Thank you. Next question again for you. And that is, why are masks mandatory indoors if I'm physically distancing?
Why are masks mandatory indoors if I'm physically distancing? It is, I think, the reason for is that it has been somehow proven that even though you are intending, or you're supposed to distance, once you enter, let's say, convenience store or your classroom or whatnot, it's not always that you know exactly what the 2 meters are, or so it is truly just And also, when you're indoor, there is no ventilation, or the air is not as ventilated as it's outside. So especially, that's when we were talking about having the windows open if we can, right? That would help whenever you are indoors. But I guess for those reasons, just because you cannot always in a small room, just think of, oh, you stay over there, that's, you just stepped 20 centimeters closer. So it would be hard to keep that in mind and monitor that all the time. So for yours, so that's why, how I guess it's been established that for everyone's safety, indoors, especially elevators, just imagine, right? Or very small, like I was saying, convenient places, or even any type of smaller classrooms. It's just for everyone's benefits to have the mask on.
Thank you, Andrea. The next question is directed to the university, and I'll answer, but I'll also invite you to step in and add anything that you'd like. And the question is, the university reports on a website the total number of cases on campus, but doesn't identify the location that those individuals have been. Does that compromise my safety or present a risk to me? The answer really is in much of what we have been talking about. As soon as we are informed, either by the student or public health, of an incident where an individual on campus, whether it's a student, a staff member, or a faculty member, feels ill or has tested positive, we are in touch with them immediately. And we will ask them where they have been, what days of the week, what times, etc. At that point, we will then be in contact with any member of our York community with whom they came in contact at that time. It could be that several days have passed before we are informed, or before the student, staff member, or faculty member has tested positive. So knowing the location without the other information really doesn't help. And it's also, as Andrea has explained, about the length of time you've been in contact and the circumstances. Andrea, is there anything you'd like to add to that?
No, and I think you mentioned that if there is such a worries, like if there, first of all, if there is a positive case, then the cohort or the class or room or dormitory will be notified. So that's what you need to know. And if they are high risk, there will be the investigation taking over, and recommendation of isolation and whatnot, and testing. But once they find out whereabouts of that person, each time there is this positive case, the area is sanitized using government approved products. So I don't think so the area would be sanitized. Yeah.
Thank you. The next question comes from our audience. And the question is, in what circumstances should a school close? Andrea, that one I'm going to hand over to you.
And I think I kind of answered that in my other answer to the other question, where every case is individual. So there is no specific criteria, laid out where you can just see if this happens, then the school would be closed. It is definitely, there has to be an outbreak, but once again, we said that the outbreak could be as little as 2 contacts, right? Would they close a school for 2 contacts? Possibly, if they find out the whereabouts of the contact and how big the outbreak actually is. So it is very difficult to say. Each case is individual, but public health is being very transparent in this case. So whenever this will happen, you all will be notified and you will know when the time comes. and it hopefully won't.
Thank you. You did cover this next question in your presentation, but I think it's important, so I will repeat the question. And that is, what if a family member is sick and told to self-isolate? Do I need to self-isolate as well if I live at home with them?
So it is, yes, if a family member, so you live with your mom, and now I'm not sure, you were saying whether if the family member is sick or if it's positive. I guess that would be two different things. So if it's positive case, then your mom has, contracted the virus and has been identified as positive case, then you definitely are a high risk contact living with her, which in that case, your next steps would be, isolating immediately and going to test yourself. You would find out based on the results whether you are positive or not. And if you are not, and you have no, symptoms, you are just advised to monitor your symptoms for the 14 days. If you are, however, tested positive, then definitely you must isolate yourself for the next 14 days.
Thank you, Andrea. And looking at the time, this will be the last question. And the question is, if I was told to self-isolate and I took a test, but it did not show positive, does that mean I'm safe, or do I need to continue to self-isolate?
So if you took a test and you were...
If I tested negative, if I tested negative for COVID-19 within the 2 weeks, the first 14 days that I was self-isolated, does this mean that I'm clear, or could I still become COVID-19 positive?
So the period of when you can contract the virus is you're most vulnerable the 2 days before that symptoms come out, and then 14 days after you have the symptoms. If you are negative, would you need to, I guess if you were asked for whatever reason to isolate for 14 days, then either way, you must complete the isolation period. And like, for example, if you were away out of country for 14 days, you will be mandated to isolate yourself for 14 days. So regardless, symptoms or not, then you need to complete the 14 days isolation. So wherever you were asked to isolate, you must complete 14 days.
Terrific. With that, it is my opportunity and pleasure to thank you so much for your presentation, and thank you for answering the many questions submitted. And to our audience, thank you all for submitting the questions in advance and for participating and submitting further questions during this session. I remind everybody, you get lots of information from us in terms of emails and notifications, and please continue to read that information. If in fact you're missing any of that, there is a website that you can go to besides the wonderful websites that Andrea shared, and that's the You Better Together website. You will also, as a reminder, be able to watch this or share with your friends if they didn't have an opportunity to attend today at the Vice Provost's website. You'll be able to review this, or others can view it for the next 7 days. Besides the You Better Together site, all students receive weekly on Tuesdays the This Week at York email, and all information is shared with you. So please take a few minutes to review that. And the You Better Together site is, go back to that, easy enough, youbettertogether.info.yorku.ca. Thank you, everybody who made today possible. Again, thank you, Andrea, and our colleagues from Toronto Public Health. And thank you, students. Stay well, take care of each other, and I wish you great success with the rest of this term. And with that, we'll come to an end. Thank you so much.